Diabetes, Pharmacy, and Me by Shay Roth and JC Hisashima, illustrated by Shay Roth. Here we have two best friends enjoying a beautiful day. But then one friend noticed something different, and she proceeded to say, "What's that?" she asked. "On your hip, just above the knees." He replied, "It's an insulin pump. It's for my diabetes." "Diabetes," she said. "Can you explain that to me?" "Of course," he replied. "Let's take a trip to the pharmacy. Here is where my medicine is prepared and stored. The people here are great. Let's go and explore." The pharmacists are always happy to teach new things to me. They talk about my diabetes. They are as helpful as can be. Diabetes is a common and manageable condition. It involves regulation of glucose and insulin. There's glucose in everything, like fruits and snacks, to name a few. It goes into your body, released as you chew. Glucose is a sugar found in many foods within, but we need a way to process it. That's why we have insulin. Insulin is a hormone made by the pancreas found in you. It brings glucose into cells to produce energy you can use. The endocrine system is important for your body's regulation. The pancreas secretes insulin, which is important for this operation. There are two types of cells. Alpha and beta are their names. They work to balance sugars. Keeping you healthy is their aim. When your sugar gets too low, it can be scary. But alpha cells recognize this. No need to be wary. They release glucagon when your blood sugar is low, raising your levels and increasing glucose. Beta cells are the opposite, taking action when sugars are high. They lower your blood sugar with the insulin they supply. There are two main types of diabetes, called type 1 and type 2. There's a significant difference, and we'll explain it to you. Type 1 diabetes means the pancreas can't make insulin, but patients can get some from the pharmacy and inject it in their skin. Insulin is injected underneath your skin at an angle with a slight little pinch. Type 2 diabetes is when your body is insulin resistant, but there are several treatment options to keep your blood sugar consistent. This type of diabetes is most commonly seen in adults. They can take oral medications and see positive results. As for insulin, there are two kinds, basal and bolus, given in different ways and times. Levels of basal insulin remain steady following injection, working consistently throughout the day with a predictable projection. This long-acting insulin can be injected once or twice a day, and in your body for 24 hours it will stay. Bolus insulin is taken before or with a meal. This short-acting form makes eating a simple ordeal. Remember the word bolus, since you eat food from a bowl. The insulin works when your tummy is full. Instead of using needles to inject multiple times a day, you could also use a pump for a constant supply of insulin this way. The pump is a plastic tube going into your skin, with a needle at the end giving you your insulin. The pump can rest nicely on your hip or belt, and when in place correctly, the needle won't even be felt. Pumps can be used in a lot of different ways, but don't forget to load the insulin every few days. It's important to monitor your blood glucose as often as your doctor recommends. To ensure your sugar is just right, they make it easy to comprehend. Diabetes can also be monitored by measuring A1C. This is the average of your blood glucose over 3 months, essentially. There are devices made for you to easily see your levels on your own. These can attach to your arm and even be read through your phone. When your blood glucose is too low, the outcome is bleak. You can feel dizzy and confused and suddenly weak. It's important to keep a snack on you to eat in case this occurs, to raise your blood sugar just enough to avoid scary concerns. A glucagon kit should always be kept on you if you feel dizzy. This will get you feeling better very quickly. Glucagon can be injected into your skin, but now you can also inhale it instead. It's so important to closely monitor your diabetes because uncontrolled, it can impact your health and cause disease. At first, diabetes can sound a little scary. Pharmacists are here to help. Don't be wary. Pharmacists are here to assist all of your needs, to keep you feeling great and help you succeed. They are here to provide education, to make sure patients with diabetes know how to take their medication. Pharmacists remind you each month to fill your insulin, to keep you healthy and your blood sugar consistent. They're there to answer any questions you may have at all. You can come visit at the pharmacy or give them a call. All of the supplies you could possibly need are available to you at your local pharmacy. Pumps, tubes, needles, and insulin, and a pharmacist available to answer your questions. Instead of going to the pharmacy a bunch, you could also get your supplies mailed to you directly each month. Pharmacists help patients with diabetes, both type 1 and type 2. Now I want to be a pharmacist to help patients with diabetes too.